51-year-old Rosa Gonzalez likes to spend time in the garden of her South Miami home. It's a departure from the stress of her job as a sales rep for Bell South. Over time, Rosa would begin to see this stress take its toll.
I was having chest pains. That I thought I was gonna die. You know, it was a lot of pressure in my chest. My heart was going 200 miles an hour. And I felt fainting, nauseated.
Dr. Christy Ballantyne is the director at the Center for Cardiovascular Disease at Baylor College of Medicine.
Well, cardiovascular disease is the #1 cause of pain, suffering, and death in our society. Actually, there's more women died from cardiovascular disease than men did last year.
Dr. Deborah Smith is an OB/GYN in the Washington, D.C. area and has worked to clear up the popular misconceptions about women and heart disease.
Only about 10 to 20% of women correctly identify heart disease or cardiovascular disease as the major threat to health. And indeed, it is the leading cause of mortality, leading cause of death.
In fact, 1 out of every 2 women will die from a cardiovascular-related disease. But only 1 in 28 women will lose their life to breast cancer. Martha Price, who's also from Miami, is a 65-year-old retired school teacher. When she found out she had coronary artery disease, it came as a diagnosis out of the blue.
The reason I found out about my heart condition was my children had asked my husband and I that we need to go get a stress test because they were concerned about our health. I didn't have any problems at all. I was very surprised about it and had no symptoms at all, with no shortness of breath.
But what Martha did have were blockages in 5 coronary arteries.
Palpitations, there was no evidence of that. And again,
Dr. Jonathan Fialco is a cardiologist at the Cardiovascular Center of South Florida, where nearly 50% of their cardiac patients are women.
Mrs. Price was an interesting case, and unfortunately something we see all too often. Her cholesterol was sky high. Her LDL cholesterol, which should be at most 100, preferably in the 80 to 90 range for aggressive care, was somewhere about 175.
Unfortunately, we're getting heavier, we're getting less exercise, diets are bad, there's smoking, high blood pressure, diabetes, and these factors cause disease in women just like they do in men.
Women are often lulled into a false sense of security because they don't typically have the same warning signs as men, such as chest pain or numbness in the left arm. Women may instead experience fatigue, back pain, and nausea, among other symptoms.
Take long strides. I want you all the way to the front. There you go.
But some women do have classic symptoms, like Rosa Gonzalez.
I started having the pressure again and the pain. So he asked me to come in right away. And he did an electrocardiogram, and he said there was some variations that he didn't like on it, and that he wanted to do a catheterization. And I'm a little scared of going to the procedure.
Okay, Rosa, we're ready to get started, okay?
Catheters enter Rosa's body through the groin and travel to the heart.
We inject iodine in the coronary arteries so we can look at the arteries on the X-ray screen. And we take several different shots at different angles so no angle from the coronaries escapes from us.
For many women, a heart catheter can uncover blocked arteries where open heart surgery might be needed. Women face twice the risk of death following heart surgery than men.
Hi, Rosa. Rosa, how are you doing? Everything went well, huh? So we have excellent news. The arteries are entirely normal. There's nothing wrong. Her heart is entirely normal.
Along with having risk factors such as being overweight and having high blood pressure, Rosa also had classic cardiovascular symptoms like chest pains. What she didn't have, as it turns out, was heart disease. Still, her risk factors needed to be managed and monitored.
Well, Rosa is a typical example of the cardiac patient, the female cardiac patient, we need to be more aggressive on. She's a middle-aged woman, she has a bit of obesity, and she has high blood pressure. And she has been complaining lately of chest discomfort. So therefore her symptoms now, we can rest assured, are not coming from the heart, are probably coming from her GI tract, from her stomach or any part of her intestine in that area. But they're not coming from her heart, and this is very reassuring for the patient, her family, and her treating physicians.
For Martha Price, a complete change in her lifestyle was in order. Dr. Fialco reviews footage of one of her 5 clogged arteries after the angioplasties.
This was the artery before, and this is the artery after.
That was my first stress test ever, and I'm very happy that I did. And I'm sure it saved my life.